topic for today is all about tdds, or transdermal drug delivery system, which is often called as transdermal patch. During 1979, first transdermal drug delivery system, which is called transdermal scopolamine, was first approved by the FDA for the prevention of nausea and vomiting, and for the prevention of nausea and vomiting associated with travel, particularly at sea. Percutaneous absorption enhancer. More than 275 chemical compounds have been cited in the literature as skin penetration enhancers. The selection of permeation enhancers should be based not only on its efficacy and in enhancing the skin permeation, but also on its dermal toxicity and its physiochemical and biological compatibility with its system other components.
Percutaneous absorption models is classified into two. First is in vivo studies, and second is in vitro studies. In vivo studies, it is a skin penetration studies may be undertaken for one or more of the following. First, to verify and quantify the cutaneous bioavailability of a topically applied drug. Second, to verify and quantify the systematic bioavailability of a transdermal drug. Third, to establish bioequivalence of the different topical formulations of the same drug substance. In vitro studies, in vitro skin permeation may be tested in vitro using various skin tissues like human or animal skin, dermis or epidermis in a diffusion cell.
Typical side-by-side diffusion cell setup used for permeability or diffusion studies. A membrane or skin can be placed in the holder in the center. There are 3 ports on each side for sampling. One can be used to insert an electrode for iontophoresis studies. Each half cell has an inlet and outlet for constant temperature, water to circulate. Typical Franz diffusion cell. The donor cell is on top and the upper and lower chambers are separated by either a membrane or skin. A solution or semi-solid containing the drug is placed in the upper cell and a receiver solution in the lower cell. The angled tube on the right is for sampling and fluid replacement. The 2 ports on the left consist of an inlet and outlet where constant temperature water can be circulated. 4-layer therapeutic transdermal system showing the continuous and controlled amount of medication released from the system, permitting the skin and entering the systemic circulation. The transderm nitrotransdermal therapeutic system. The patch delivers nitroglycerin through the skin directly into the bloodstream for 24 hours. Transderm nitro is used to treat and prevent angina. The system consists of a water-resistant backing layer, a reservoir of nitroglycerin, followed by a semi-permeable membrane to control precisely and predictably the release of medicine, and an adhesive layer to hold the system onto the skin. The adhesive layer also contains an initial priming dose of nitroglycerin to ensure prompt release and absorption of medication.
Advantages of transdermal dosage form. Number 1, they can avoid gastrointestinal drug absorption difficulties caused by gastrointestinal pH, enzymatic activity, and drug interaction with food, drink, and other orally administered drugs. Number 2, they can substitute for oral administration of medication when that route is unsuitable as with vomiting and diarrhea. Number 3, they avoid the first pass effect, the initial pass of a drug substance through the systematic and portal circulation following gastrointestinal absorption, possibly avoiding the deactivation by digestive and liver enzymes. Number 4, they are non-invasive, avoiding the inconvenience of parenteral therapy. Number 5, they provide extended therapy with a single application, improving compliance over other dosage forms requiring more frequent dose of administration. Number 6, The activity of drugs having a short half-life is extended through the reservoir of drug in the therapeutic delivery system and its controlled release. Number 7. Drug therapy may be terminated rapidly by removal of the surface of the skin. Number 8. They are easily and rapidly identified in emergencies because of their physical presence, features, and identifying markings.
These are the disadvantages of transdermal drug delivery system. First, only relatively potent drugs are suitable candidates for transdermal delivery because of the natural limits of drug entry. Second, some patients develop contact dermatitis at the site of application from one or more system components. Example of transdermal drug delivery system. The first one is the transdermal scopolamine, which has a brand name of Transdermscope. It is the first tdds to receive FDA approval. It is used to prevent nausea and vomiting caused by motion sickness or recovery from anesthesia and surgery. There are two common side effects of this system. The first one is dryness of the mouth and drowsiness. It is worn in a hairless area behind the ear. The second one is the transdermal nitroglycerin, which has a brand name of Nitrodert. It is used to prevent chest pain in people with certain heart disorder. These tdds are placed on a chest, back, upper arm, or shoulder. The third one is the transdermal clonidine, which has a brand name of Catapres. It is used to treat high blood pressure. It is placed on the hairless area of intact skin on the outer arm or chest. The next is the transdermal nicotine, which has a brand name of Nicotrol. It is used as adjuncts in smoking cessation program. It is usually applied to the arm or upper front torso, with patients are not advisable to smoke when wearing this system. The fifth is the transdermal estradiol, which has a brand name of Estrogen. It is indicated for treatment of moderate to severe vasomotor symptoms associated with menopause. It is applied to a clean, dry area of the skin on the trunk of the body, either the abdomen or upper quadrant of the buttocks. The next is the transdermal contraceptive system, which has a brand name of Ortho-Ibra. It is a novel combination hormonal contraceptive that contains the hormones norelgestromin and ethinyl estradiol. The last one is the transdermal methylphenidate, which has a brand name of Ditrano. It is indicated for attention deficit hyperactivity disorder in children.